This is part 3, and this is one way of addressing a pelvis that has developmental asymmetry. When he sits in the chair with his feet together, he's taller through the right tibia. This thumb is higher towards the ceiling, and this femur appears longer, it's more forward. And so when he takes this piece of foam, it's a soft foam, and he places it under his left trochanter. Not too deep, not too deep. Pull it out a little bit. Pull it out a little bit more. Let me see. Yeah, perfect, perfect. Okay. So tell us how you feel with that foam under the hip.
Feel more even. I feel more even.
Very good.
I don't feel as if there's that I'm leaning to some direction or the other. I feel actually that it gives me support.
Yeah. And you know, if your pelvis was symmetrical, this would make you uneven. But your pelvis developed asymmetrically, so we're just supporting your natural asymmetry.
Yeah, can I actually add something?
Please.
I forgot to mention
Please.
something to you. When I injured my coccyx,
Yes.
14 years ago,
Yes.
I always, after I injured it, I always used to sit
Off to the right.
off to the right or to the left.
Or to the, yeah,
So
interesting.
that's, I think, maybe why it developed over time, this asymmetry. I
Yeah,
forgot to mention
and you
that.
were 21 at that time.
Yeah, 21.
And your pelvis develops all the way up to age 25.
That's it.
So it could have influenced, I don't know. You know, it's hard to know.
Yeah, I feel definitely it contributed.
Yes,
Whether it was already whether it already had propensity or not.
sure,
That's also another thing.
sure thing. Yeah. So how do you feel when you take this foam under the right hip?
When I remove it.
Yeah, move it to the
put
other
on
side.
Right hip. Yeah. Yeah, it definitely.
It's not.
Yeah.
Yeah, it's makes you uneven, doesn't it?
Yeah, I'm like this.
Exactly. Okay, so take it out.
Yeah.
And you can put it under the left. So you could, we certainly sell these foams, we sell them for $15, but you could roll up a couple of washcloths and put a rubber band on it or put duct tape and bingo, you'd have your own. I would make it about 2 inches diameter.
I see.
And you can keep one in your car for when you drive more than a half hour at a time. And then you could keep one at home at your computer.
Does it impact my walking
No.
functionality?
No, it doesn't.
Okay.
No. Your muscles developed with the asymmetry, so they developed an appropriate length.
I see.
There's no way to make this pelvis straighten out.
Yeah.
You don't need gobs of therapy to address this alignment.
Yeah.
You need simple solutions,
Yeah,
which is
absolutely.
number 1. Keep the mobility, which we treated you for gaining mobility, and we'll teach you tomorrow how to do those on your own as well.
Okay.
And you just have to do them like once a week or so.
Okay.
And then the other thing is that you support it like this when you're in prolonged sitting. And that should increase your sitting comfort. And so thank you. It's a great example of what we can do with a pelvis or hip that has a developmental asymmetry. There's still something you can do, which is support that asymmetry in sitting. But there's no need to worry when you're laying down or when you're standing. The body does fine with it.
Gotcha.
Okay, good. So I'll stop filming, and I hope that this film is of value educationally.